Hi class, this is my flashcard for this week, and my topic is trisomy 18. So trisomy 18 is also known as Edwards syndrome, and it's a chromosomal abnormality that results in an error during the cell meiosis with a loss or displacement of the DNA fragment. So with trisomy 18, there are 3 copies of the chromosome 18 instead of the usual 2. And trisomy 18 is the second most common chromosomal birth defect after trisomy 21, which we know as Down syndrome. So there are 3 copies of the chromosome 18 that are made during the gestational cellular division. That results of an extra chromosome are considered birth defects or congenital abnormalities. And Edwards syndrome, or trisomy 18, has 3 distinct diagnoses. One is full trisomy 18, which is 95% of all the cells carry the extra chromosome. And this is the most common trisomy diagnosis. It is not considered hereditary or genetically passed from parents to baby. Then there's partial trisomy 18, which is where a partial piece of the 18th chromosome is attached to some cells, but not all of the cells in the DNA. And this is considered a rare diagnosis. And then there's mosaic trisomy 18, which is the rarest of the 3. And it happens when the third 18th chromosome is present in some, but not all of the cells, meaning less than 50%. So while there are no specific risk factors known for trisomy 18, the maternal age over 35 is considered a risk for chromosomal defects, both with trisomy 18 as well as with Down syndrome. The major signs and symptoms are that babies born with trisomy 18 have very distinct body features of a very small mouth, small jaw, and a short neck, as well as malformed ears, sometimes referred to as like elf ears, as they come to a point. They have clenched hands with overlapping fingers and a flexed big toe. Also, the birth defects can include many heart defects like ventral septal defects, atrial septal defects, smaller misshapen kidneys, part of the intestine outside of the abdominal cavity, esophageal atresia, and significant developmental delays. There's a poor prognosis for infants that survive birth with trisomy 18. And there's a picture here of what a baby with trisomy 18, their features would look like, including this kind of strawberry-shaped head, which is often initially diagnosed by ultrasound. The other diagnostic testing that they do is an amniotic fluid sample as well. And there are my references. Thanks.